I was telling Gwen today when I stopped by the office for something that I got an email from a good friend and supporter and, well, I'll just say good friend, who was very concerned because she has a female dog who is fairly prone to bladder infections. So she's doing everything she can to prevent bladder infections. So she feeds a raw or gently cooked, very high moisture diet because we want to encourage urine flow and rinsing of the bladder. She also uses cranberry supplement or fresh cranberries. She uses D-mannose. I forget what else. She's got the dog on quite a few supplements to try to help prevent urinary tract infections. And then she monitors the urine pretty closely. So there's a couple ways you can monitor urine. And we have a cat who's actually, I think we have multiple cats who are peeing outside the box. And Gwen said, boy, that has kind of an odor. I think we should get a urine sample and take it to the vet. And I said, well, I can check that at home. So even our kitty cats, we can get urine samples on. There's a couple ways you can do it. There is a non-absorbent litter. We have it on the website that you can clean out the litter box and put that in and let them pee on that. In our case, the kitty cat was nice enough to pee on a granite countertop. So I could just take a urine diagnostic dipstick, which we have those on the website as well. And I dipped it in the urine and waited for the 60 seconds for everything to come up. And there was no blood, no red cells, no white cells. Normal specific gravity, normal pH. So Kitty does not have a urinary tract infection. Kitty's just mad because there's 13 kitties. So we have to work on that with our herb gardens and our behavior modification and that kind of stuff. So, but this friend who emailed me with the dog who's prone to infection, she monitors the urine and she took a sample in, and the sample came back with a pH of 7.5, and she was really worried because when we have a bacterial infection in the urine, the pH will go up. So the normal pH that we would love to see is 6.5 to 7. And hers came back at 7.5. So she was like, oh, what am I doing wrong? I'm already using cranberry and I'm doing all these things. Well, 7.5 is okay. 6.5 to 7.5 is really the range where we want this urine to remain. If we get too low, if we get below 6, like we're running 5, 5.5, then they're really likely, both cats and dogs, to start making oxalate crystals and oxalate stones. So we don't want it to get too low. And then on the other hand, if they have a bacterial infection, that pH of the urine will go up and it'll be 8, it'll be 8.5, it'll be 9. Somebody emailed me last week and said, oh my gosh, my dog's urine pH is 9. What do I do about this? I said, do a culture. I don't care what the sediment looks like on the urinalysis, but with a pH of 9, you better be looking for bacteria in there because 9 times out of 10, that's where it's going to come from. Now, kibble-fed animals who have more starches and grains in their diet will tend to have a higher pH than raw-fed animals who are eating a mostly meat, organ, bone, fiber, low starch or no starch diets. So it's going to vary a little bit based on the diet. But for my friend's dog with the 7.5, we also have to remember that depending on how far the urine is taken from when they ate, how long the urine sat in the bladder, that can cause variations throughout the day. So if you were to test every single urine sample, yeah, you can give a cranberry supplement when the pH level is normal because it helps E. coli keep from sticking to the bladder wall. D-mannose kind of does the same thing. So if you were to, and I've had clients who do this, those metal personalities who like spreadsheets for everything or notebooks with everything written down, and they'll test every single sample all day long and then bring it to me with how long after they had breakfast, how long after they had dinner, whether it was first thing in the morning. And we will see variations in that urine pH. But what you're looking for is what's the overall average over time. I mean, if you feel like burning money, you can dipstick every single urine sample, and you don't have to use the 10 strip diagnostics. You could get just a pH strip. You can get them for your pool water when you're testing your pool. So you can get it at a pool store. You can get them pharmacies. You can get them anywhere. So you could just test the pH of the urine. but you will see variation. So it may go down to 6 sometimes. It may go up to 7.5 sometimes. It may be 6.75, but we want to be somewhere in that range and not freak out if it's a little bit out of range on a particular sample. If you get something that's really out of whack, really low or really high, I'd repeat that with another sample and see it, or get a few samples and see, is that where it's staying all the time? Because if so, then we have to do some modifications. If it's overall average is somewhere in that 6.5 or 6.5 up to 7.5, then you're fine. But again, if you're getting 8.5 or 9, look for problems in that urine sample. So somebody posted on the post that their dog was treated repeatedly for a urinary tract infection. And when they finally got diagnostics done after about 2 years, what they found was the dog actually had a transitional cell carcinoma in the bladder. They found it on ultrasound. So if you have an animal who is getting repeated urinary tract infections or repeated blood in the urine, and this is another problem that I see very, very commonly. We'll see red blood cells in the urine, and they'll instantly get put on antibiotics. So this is what I mean by over-treatment. So they'll automatically put them on antibiotics because there was some blood in the urine, some red blood cells in the urine, or if they see bacteria on the sediment and it was a free catch sample. Well, a free catch sample is going to have a good chance of getting contaminated on the way out of the body, and depending on what you're catching it in. So interestingly, I was doing urinalysis on my animals. We were videoing catching urine samples and testing them with the dipsticks. And George, when I got his sample, when he lifted his leg, and then when he put his foot down, he put his foot in the cup and lifted his foot back out. I still had plenty of urine, so I tested it. It looked terrible. It looked like he had a horrible urinary tract infection. It looked like it had, a high pH. And I thought, oh, geez, he's a mess, and I didn't even know it. Well, I went back and got a clean sample that he didn't put his foot in, and it was perfectly fine. So it's really easy for these samples to get contaminated. If you're sucking them off the floor, sucking them off a table, really easy for them to get contaminated. And so we get a lot of over treatment. So if you have bacteria that you see on a free catch sample, you also have to look and see, were there a lot of white blood cells? Because if you have an infection, there should be white blood cells. Not always, but there should be white blood cells there. And the pH should be high. So if you have bacteria that they see on the sediment when they spin it down and look under the microscope, but the pH is perfectly normal, there's no red cells and there's no crystals, very well may be that there is not an infection there. So don't run immediately for the antibiotics. Say, I'm going to get another sample. We're going to get a really clean sample, or we're going to go directly in the bladder and get the sample, or we're going to culture the sample, because we've talked so much over the years, and we talk about it more and more and more all the time, about the microbiome and how we can really screw up the microbiome in the lungs, on the skin, in the bladder, literally the whole body, every time we give an antibiotic. So when you give, and unfortunately, when we have a urinary tract infection, very commonly the veterinarians are prescribing antibiotics for anywhere from 2 to 6 weeks. Like, nobody does short course. And there was just an interesting article in the AVMA, which is the veterinary journal, and it talked about treating urinary tract infections for 5 days instead of 14, 21, 28, 42. And they did studies with animals with urinary tract infections and treated them for 5 days instead of the long course, and then recultured and found that most of the animals are fine with 5 days of antibiotics. And frankly, for humans, unless you're having infection after infection after infection after infection, we do not treat for 2 weeks for urinary tract infections. It's usually a 5-day course. So really, really different. And we're starting to think about the overuse of antibiotics. We're starting to think about the over treatment of our animals and then building resistance. So when you give those antibiotics, you're going to get some bacteria that are going to say, ha 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 ha, I can build my body better. I can resist that. And then we end up with MRSA. We end up with, I'm seeing urine cultures with Proteus, Klebsiella, Pseudomonas. You name it. We're getting all kinds of really, really nasty things. So you only want to treat if they absolutely need to be treated. So it is, if you have an animal who's been prone to urinary tract infections, and they're more common in middle-aged to older female dogs. That's going to be the most common group. We see more lower urinary tract disease, I think, for the kitty cats in the boys than we do in the girls. But for them, it's almost always diet-related. Cats do not. They usually have a sterile cystitis, so they have an inflammation with no bacterial growth. Kitty cats are very, very low percentage of their urinary tract disease is actually a bacterial infection. Very low. So for the cats, it's all about the high moisture diet, preventing crystal formation, monitoring that pH, and really encouraging more liquid consumption. So whether you're doing goat milk, bone broth, water added to the food, but definitely high moisture diets. For our dogs, much more common to see urinary tract infections in girls. When I would see it in a male dog, I would kind of be like, whoa, what's going on here? Because it's just not that common. And a lot of times with the boys, it's related to prostatic problems. So prostate infection, inflammation, enlargement, something going on, not just specifically with the bladder. And then for animals who are not emptying their bladder as well, so we get the older animals with arthritis that are having a hard time getting in position, so they don't go as often, they hold their urine more, and they're not flushing that bladder through, so they're going to be more prone to urinary tract infections as well. So if you have an animal who's prone, I recommend monitoring with the urine strips, because you can do it at home really easily. And then if the dipstick, the monitoring is suspicious, then you can get a sample off to your veterinarian and say, hey, I need a full urinalysis on this, because they're expensive, guys. They're, most urinalysis, a complete urinalysis is probably running around $50 right now. I don't really know, because I never take a urine without blood work and everything else, so it's always part of something else, or pretty rare. But so the little dipsticks you can monitor at home, and then if you see signs of trouble, you can get a sample in. And if your animal is treated for a urinary tract infection, please, 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 after you give the antibiotics, in a couple of weeks, take another sample in and make sure that the antibiotics did the job. Because one of the reasons we see these repeat infections is that the infection never got cleared up. It got a little better, the symptoms decreased, so you think, oh, they're doing fine. And then a month later, you're like, man, here we are again. So girl dogs who have what we call an invaginated vulva, so it's kind of an innie, it sinks in, or obese animals are going to be much more prone to urinary tract infections, particularly the girls. Most of the bacterial urinary tract infections that we saw in cats were female obese, those 25-pound cats where everything just folds in. They can't get back there to groom. It stays moist back there all the time. They are a mess. So good reason to keep your kitty cats not overweight. So keep them nice and lean. And then for the dogs, if they do have a tucked up vulva, it's like you kind of have to peel things apart to find it in there. Definitely allow them to go through 1 or 2 heat cycles, which we're recommending now anyway. But when they go into heat and they get that swelling, sometimes that'll pop things out of the folds a little bit. In practice, I actually fairly frequently, because a lot of these animals were being spayed very, 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 very young, a lot of rescue puppies and things, we would have to do something called a vulvoplasty, which basically is plastic surgery to get rid of that pocket and bring the vulva out to stop the infections. Because if you have a female dog with that problem, they're going to have repeat infections. So you have to be really good about keeping things clean, keeping everything wiped out back there, not letting them get all yeasty and moist and all that kind of stuff.